practitioner role is for registered nurses who develop advanced training to treat both individuals and populations. So family nurse practitioners are prepared for primary care. So we take care of medically stable patients in a variety of settings. So primary care is designed to be comprehensive and really promote health promotion, preventative care, health screenings to pick up conditions such as cancer in an early stage to prevent the complications of a later stage. Same thing with detecting diabetes, high blood pressure, which can be kind of silent killers or silent effects on the body before someone is aware that they have that condition. So the real privilege we have in primary care is establishing a relationship with patients across the whole family spectrum, so from birth all the way to end of life. We have that ongoing relationship with them to provide that comprehensive health care. Family nurse practitioner students can be placed in a variety of settings. So we have over 400 clinical partners across the region, and we partner with them to have our students do rotations in practices such as family practice, family medicine offices, internal medicine, obstetrics and gynecology practices. They may rotate there for their women's health content. We also have pediatric primary care practices that they rotate through. In addition to some specialty practices, they may do a certain number of hours in a cardiology practice, and gastroenterology and dermatology, so that provides them with a more concentrated experience with those particular health conditions that we see in primary care on a regular basis. Our School of Nursing, we really strive to promote clinical reasoning in our students. So as they make that transition from a registered nurse to advanced practice registered nurse or into the nurse practitioner role, we want them to be thinking differently on how we can address patient conditions. And so for the telehealth simulation activity, we have students from home join us in a video conference in our Center for Simulation and Innovation. In the exam room in the Center for Simulation, we have a faculty member as well as a standardized patient or a mannequin who is the patient in the clinical scenario. And so the student will walk through what history questions they need to ask, and then based upon what the faculty or the standardized patient tell them, they have to figure out what physical exam am I going to do for this particular patient. And then they come up with a list of differential diagnoses, and they justify why or why not that diagnosis fits with this scenario or with this particular patient case. And so they're really able to put that application of what they've been learning in the classroom into practice so that they can formulate differential diagnoses and then formulate an evidence-based treatment plan. The nurse practitioner role, and especially those prepared doctorally in our Doctor of Nursing practice program, are going to be prepared to make improvements on a system level. So not only do our nurse practitioner students learn how to care for individuals, they're going to learn how to evaluate healthcare organizations and to be efficient, to be high quality. And so as part of their education, they will be conducting a Doctor of Nursing practice project. So they will have a faculty mentor who will mentor them through this project, and it will kind of culminate with actually implementing this project within a clinical enterprise. We at the School of Nursing really want to live out our vision of promoting health as an act of social justice. And so we have several community engagement opportunities for students. We have a global health distinction program that students can enroll in their first year in the program. And this will provide them with opportunities to really put those cultural competency into practice and experiential learning. So they would go on an international trip where they would provide care to a diverse set of patients overseas. We also have local cultural events that our students are involved in. We have several clubs or societies within our School of Nursing that promote various cultural events. We also have the San Antonio Refugee Health Clinic, which is an interprofessional clinic that our students lead and manage, along with faculty mentorship from all three, the School of Medicine, School of Dentistry, and the School of Nursing. And so we have several opportunities like that for our students to engage in and really open up, their world. Because it's a health science center, we have our other health profession colleagues who can be guest speakers for us, whether it's, gastroenterology fellow from the Department of Internal Medicine or a cardiology fellow. So we have had several guest speakers join us in this education effort. We also have interprofessional education activities that the university is really promoting. And so having medical students, physician assistant students, respiratory therapy students, and nurse practitioner students all working together, whether it be in a simulation experience or in the classroom or in some of these co-curricular activities such as working at the San Antonio Refugee Health Clinic. All of these different experiences really help promote that team-based learning and preparing our students to be that team player within the health professions, because providing care to patients, as the Institute of Medicine has said, is a team-based skill that our students need to come out with being able to do and do it well. Be motivated to keep learning. We are going to provide those courses that will give you a solid base in how do I search the literature, how do I find the best evidence for this clinical problem. And so we will definitely work as faculty mentors and facilitators to your learning. But it does, in graduate school, it does take the student to really take ownership of their learning process and that desire to be the best healthcare provider and health promotion clinician in the end, and also to have life adjusted so that you can devote enough time to your studies. We find that our students oftentimes continue working in their registered nurse role during their program, but many have to cut down to part-time or as needed on their employment basis. So being flexible in your schedule and putting the priorities where they need to be from the get-go so that you can be successful and put the time in and the quality time into studying and to devoted to the program. So our School of Nursing has a whole team of full-time faculty who are devoted to living out our mission of teaching, research, and service. Our nurse practitioner faculty in particular also practice clinically. And so I know oftentimes students really appreciate that we can apply these concepts that we're teaching in the classroom to real-life patient examples. And so continuing our clinical enterprise, we continue to practice with patients, and then we also precept students as well. And so we're definitely highly engaged with our students and have that availability to be one-on-one with them as needed for office hours, as well as working with them in the actual clinical setting and throughout their courses. So the job prospect upon graduation is very good for nurse practitioners at this time. The number of nurse practitioners in the country have risen dramatically in the past 2 decades, and the wages have also increased. We will see as we go, but currently our graduates are finding work in urban areas, particularly in specialty areas, internal medicine, geriatrics. And then in the rural areas, there's a huge need for family nurse practitioners to provide care across the lifespan.